Assalamualaikum warahmatullahi wabarakatuh. Thank you to the organization committee for the opportunity to enter this event and my respect to the reviewer team. My name is Fadli, lecturer from the profession program Nurse Tikus Muhammadiyah Sidrap. I am a team representative for presentation of research result. With the title of research, relationship between self-care behavior and diabetes self-management education in patients with the diabetes mellitus type 2. The outline that we will discuss from this presentation is number 1, introduction, number 2, methods, number 3, result and discussion, and number 4, conclusion. Introduction. Diabetes mellitus is a metabolic disease with the description of the insulin hormone with a function to maintain the body homeostasis by decreasing blood sugar level. One of the most common types of the diabetes mellitus disease in the world is diabetes mellitus type 2, 85 to 95%. Diabetes mellitus of type 2 is chronic disease and global health problem, affecting approximately 422 million people worldwide. The global diabetes prevalence in 2019 is estimated at 9.3%. 463 million people, increasing to 10.2%, 578 million in 2030 and 10.9%, 700 million in year 2045. The cause of diabetes mellitus type 2 are unhealthy lifestyle, imbalance of diet regulation, and lack of physical activity. This is influenced by self-care behavior. Factors that influence self-care behavior are factors from the patient himself, namely knowledge, motivation, economy, attitude, family support, self-efficacy. Good self-care behavior has an important role in the diabetes self-management education, especially in preventing diabetes complications. The application of diabetes self-management education is one of the effects that plays an important role in the management of type 2 diabetes, including diet regulation, physical activity, monitoring blood sugar, complications with any medication, consumption, and food care. Therefore, the research wanted to know the self-care behavior with diabetes self-management education in diabetes mellitus patient type 2 in Sidrap Regency. Methods. Number 1, type of research. This type of research is observational correlation with a cross-sectional approach conducted from May to July year 2020 in Regency Sidrap. The variable used in this study was the diabetes self-management education as the dependent variable, and the independent variable was self-care behavior. Number 2, sampling technique. The sampling technique was determined as consecutive sampling technique. The number of samples that were targeted in the research subject. There were 115 who the research criteria. Number 3, analysis test and structure model of research. The analysis test is a linear regression test to determine of the relationship between the variable self-care behavior and the diabetes self-management education variable for diabetes mellitus patient types 2 with a value and significant 0.05, which is considered significant, and look at the structural model of research using the structural equation model, same with IMOX 2.0 and SPSS version 20. Result: the result of regression WAC variable self-care behavior. Self-care behavior variable are formed by four factor: knowledge to self-care behavior, motivation and self-care behavior, family support and self-care behavior, self-efficacy and self-care behavior. From the four factor, the self-care behavior variable information was obtained. The all factor had a significant relationship with the formation of the patient self-care behavior, and it was known that the knowledge factor was the most related factor or played of a role in the formation of the patient self-care behavior variable with p-value 0.00, and the estimate value of the effect is 0.89. So that real and strong knowledge plays a role in formation self-care behavior variable. The diabetes management self-education is formed by five factors: treatment, diabetes mellitus self-education, blood sugar control, and diabetes management self-education, diet and diabetes management self-education, physical activity and diabetes management self-education, and food care. From the five factors of the diabetes management self-education variable, information is obtained that all factors have a significant relationship with the formation of the patient diabetes management self-education variable, and it is now the blood sugar control factor is the most related factor or plays a role in the formation of the patient diabetes management self-education variable with a value less than 0.00, and estimate effect value is 0.981. So that controlling blood sugar significant and strongly plays a role in formation the diabetes management self-education variable. Test result of research hypothesis. Relationship between variable self-care behavior and diabetes management self-education. It can be seen that self-care behavior has a significant effect on diabetes management self-education of type 2 diabetes mellitus patient. To see the percentage of the effect is R square 0.475, meaning that self-care behavior has an effect on diabetes management self-education by 47.5%, while the remaining 52.5% is the influence of other variables not studied. The overall model validation value can see from the fitness of fit value obtained by 0.569 tends to be moderate. So this value indicates a good fit between the model and theory use, namely the theory of Oren. Conclusion. This study proves that diabetes self-management education is influenced by the self-care behavior of diabetes mellitus patient type 2. The structural model produced in this study is able to explain more that half of the self-care behavior variables compared of the variables not studied. The knowledge factor is the most related factor or plays a role of the information of self-care behavior variable for diabetes mellitus patient type 2. This means that the greater of patient's knowledge, the better the self-care behavior and self-care management for type 2 diabetes mellitus patient will be. Therefore, the management of diabetes mellitus must be more active in providing education to servers so that their knowledge of family members can increase and understand how to do diabetes management properly. Thank you to the organizing committee for the opportunity to enter this event and success for next event. Amin. Assalamualaikum warahmatullahi wabarakatuh. Thank you.